So the LYRA study is a study we began about 3 years ago or so, and the idea was several-fold. First of all, we wanted to try and teach people how to use daratumumab effectively and gain some information about infusion reactions. So in the study schema, we actually split the first dose of daratumumab into 2 equal doses to minimize infusion reactions and shorten infusion times. Thereafter, daratumumab was given according to the label. And then one of the unique features of this study was that patients were both newly diagnosed and relapsed and were allowed to proceed on to stem cell transplant should the clinical circumstance dictate. In the event the transplant took place, the patients were then allowed to re-enter the study and receive 12 months of daratumumab given in the maintenance setting. And at this ASH, we'll present updated results showing that we got deepening responses during the maintenance and hopefully improvements in progression-free survival. So what the results show is that in each group studied, whether you were newly diagnosed or relapsed but not refractory, with the daratumumab maintenance, the greater than or equal to complete response rate rose, as did the overall response rate. In addition, preliminary analysis has shown an improvement in progression-free survival. However, you have to bear in mind for overall survival, given the advances we're making in multiple myeloma, the data is still somewhat immature. So I don't know that this will be a giant practice-changing study, but what it does is it makes administration of the CyBorD combination much easier. As you get further into the number of infusions in daratumumab, infusion reactions fade away. And I think what will be exciting is when daratumumab is released in the subcutaneous formulation, and instead of sitting in the chair for infusions, you'll be in and out of the clinic quite quickly. Hopefully that'll lead to an improvement in the patient's quality of life, because we are doing quite well in multiple myeloma, and we want everything to be an effective treatment that doesn't negatively impact the patient's quality of life. I think another important feature of this study, especially for the European audience, is that this is an IMiD-free regimen. So there's no lenalidomide, there's no pomalidomide, and I think this has clear economic and access issues. So I think this study will be something that's very relevant and will help us to battle the ever-increasing costs of myeloma therapy.